Well, hello, folks. My name is Craig. Just up front, I'll tell you I'm not an experienced YouTube video maker. Don't have any real inclination to spend a lot of time making videos of myself. But I did want to take a moment and share some information with anyone who may be experiencing what I have experienced coming through long-term, chronic, recurring, severe knee pain, and it's taken me several years to get to a point where I think I finally have identified what's causing it. There may be somebody else out there that's experiencing this, and I just want to maybe save somebody a few steps in the process. Quick history so that you'll understand what I've experienced. January 2011, had surgery on my left knee for a torn meniscus. It was supposedly a straightforward surgery. Family friend did the operation. Also, a surgeon who is affiliated with a professional sports team in the football team in the city where I live. The surgery revealed, severely torn meniscus, but nothing out of the ordinary. Post-operatively, was in a massive amount of pain, something that shouldn't have occurred as a result of just that surgery. Went back to this through my post-op care. The surgeon was disinterested, to say the least, in the amount of pain that I was in. Attempted to treat it with just a massive cortisone injection. And so consequently, it did not go away. It didn't get better, so I continued on about life, dealing with a lot of pain. About several months after that, 3 or 4 months after that, was at my second home in North Carolina, and I had a chainsaw accident, simply my own negligence. Came across the same knee with a chainsaw. Didn't do any severe damage, but did cut into the same knee. Took a long, long time for that to heal, but it didn't really disrupt the injury, or the surgery rather. So over the next year, massive amounts of pain. Went to then the preeminent knee orthopedic, which was the second orthopedic here in town. He identified that it was probably patellar tendonitis, and began and convinced me to spend a fortune on ACP injections, which you can look that up, what an ACP injection is. It's not an approved procedure that's covered by insurance, but it does work, in some of the high-profile athletes and things, which I am not. But I spent a lot of time doing ACP injections, a lot of deep injections also of various painkiller type lidocaines and Marcaine solutions to break up what he thought it might have been bursitis in that same knee. Again, months spent with that second orthopedic. No testing was done, strictly analysis, diagnostics based on what he thought. That occurred up until about the last 8 months. I stopped going to him because I was just absolutely getting nowhere, spending a fortune. Went to a third orthopedic who came to me, very highly referenced through a mutual friend. And even with this orthopedic, thought it was tendonitis, put me on back-to-back high doses of Medrol dose packs. I've been over the course of time on so many steroids. I didn't like taking it, but I thought the pain was severe enough where I'd try it. And again, I'm giving you this detail because there could be somebody else who's experiencing something similar, and I want you to understand the diagnostic process that I went through that was a massive waste of money and time and heart on my body. Through this, I went through the massive doses of prednisone. Nothing helped still. I mean, I didn't have any inflammation anywhere else in my body, but my knee did not. It was no better. Got to the point of massive pain, having to take a pain pill, a narcotic type pain pill, once a day, every day. And at the end of the day, it was just massive. The only thing that would relieve it is a very tight brace, a lot of compression, which is odd, but that's the only thing. It was directly below my kneecap, in front of and below my kneecap. This third orthopedic seemed somewhat perplexed still. Didn't have a solution. My suggestion, and this is really where I'm going, is over time I have learned the value of becoming my own #1 advocate for my health care, learning, researching, studying, finding out. So I asked this third orthopedic, look, why doesn't somebody order an MRI? Let's see if there's something else going on in there. So he ordered the MRI. We found out that there was a new meniscus tear. That's not that remarkable because I'm an active person. And so anyway, the meniscus tear in itself typically wouldn't result in the kind of pain unless there's an impingement associated with it. This did not appear to be the kind of meniscus tear that had an impingement. But the MRI also revealed something that is rarely ever mentioned, and I had no previous knowledge of, and that was an enlarged infrapatellar fat pad. It seemed inconsequential to me until I started studying it and finding out that it is actually a really infrequently diagnosed condition called Hoffa's disease, as in Jimmy Hoffa, H-O-F-F-A. Hoffa's disease or Hoffa's syndrome. The orthopedic, upon seeing that in the MRI, said this is interesting because this large overgrown fat pad can now become impinged in between the femur and the, I guess, tibia, or whatever the bottom bone in your leg is. And so ordered a knee scope to handle the meniscal tear and look at shaving down that fat pad. Well, that was 4 days ago. I had the scope 4 days ago. The scope revealed a severely oversized fat pad that the pictures taken during the surgery are just so inflamed, such high inflammation and such redness from this long-lasting, probably 2.5-year impingement, that he immediately came out, told my wife in the recovery process that he removed approximately 3 inches across my knee, arthroscopically, a lot of material, a lot of cauterization because this fat pad is very heavily vascularized. There's a lot of blood vessels in there, a lot of nerve endings. So the interesting part is it appears, now I'm only 4 days post-op, so I really don't know if this has solved the knee pain, but it would appear that this has identified the knee pain, and that he clearly has a very strong opinion that this is the hidden culprit. So for anyone who is going through long-term chronic knee pain, that you absolutely have done everything you can think of, and you've treated for patellar tendonitis, you've used the anti-inflammatories, which I've been on for years for other things, you've been to the orthopedics, do not put your trust blindly into docs. Do your own research, consider all your symptoms over time, and suggest things. Suggest things to your doc, because if you don't, you're relying on whatever diagnostics seem to be familiar to them, what they work with a lot, what seems logical. This Hoffa's syndrome is something that, for many people, it's treated non-surgically. In my situation, because it's gone so long, and because of the severe impingement, and apparently an anatomical issue of it just being really overgrown, it would respond to nothing except the surgical. So a large amount of it's been removed. Chronic knee pain that you've done everything for, do not forget to think about the infrapatellar fat pad and have it looked at in an MRI, because like I did, you could have all the surgery in the world and come out of surgery feeling just as bad as you did when you went in. Yeah, you can fix that meniscal tear, but that wasn't the source of my severe pain. It has definitely been also probably this fat pad. Now, we'll know more as time goes on and as just the pain from the surgery clears up. I hope this information helps somebody. Don't forget to think about this Hoffa's, as in Jimmy Hoffa, Hoffa's syndrome, or otherwise known as Hoffa's disease, and talk to your doctor about it. If he's not familiar with it, you be familiar with it, because let me tell you, it's anything for relief, and if you being more informed provides relief, then go that route. I'll try to provide an update, second video, once I'm fully recovered, so that I know whether or not this, in fact, has resolved the pain issue. Thanks and good luck to you.